and hopefully your solutions. Which we call CASE, is working with the Cleveland Foundation to host a series of virtual community-wide conversations in the latter part of October. There are 3 separate dates and times that you can choose from. Friday, October 23rd from 11 a.m. to 12 p.m., Saturday, October 24th from 12 p.m. to 1 p.m., and Monday, October 26th from 7 p.m. to 8 p.m. Starting next week, there will be a page live for you to sign up, so keep an eye on our homepage, our county homepage, our social media feeds, and we'll also be sending out a release to the media. These conversations are open to anyone who wants to participate in a conversation regarding structural racism and how we as a community address this long-standing, complex, and quite painful set of issues. CASE will be using the Common Ground platform that's now in its 4th year, which the Cleveland Foundation has used to help gather and amplify many voices across our community. The Common Ground platform supports meaningful dialogue, which in turn helps create meaningful change. We're hoping to have hundreds of voices included in this work. There will be facilitators and scribes who will moderate and capture your ideas and your concerns. And then all of that material will be pulled together to be shared as part of CASE's report back to the community and to the county government for use in crafting initiatives. This work is hard, and it is necessary. I'm committed to open communication and transparency as we move forward. Finally, I want to talk about voting. Voting is one of the most sacred and meaningful ways that we can make ourselves heard. Now, why do I say sacred? Because people have died for our right to vote. Unfortunately, we're seeing the legitimacy of the entire election process called into question. I'm going to make this very clear, very clear. In Ohio, in Cuyahoga County, the process works. Your vote is safe. Your vote is secure. Whether you choose to vote by mail or in on election day or before, you can rest assured that your vote will be counted. Our electoral system has been in place since 1778 without being called into question. The attacks on voting are meant to intimidate you. Do not let that happen. Our democracy is strong, and it relies on you to keep it strong. So first things first, if you haven't registered to vote, there's still time. Not much, but there's still time. And it's easy. All you have to do is go to 443vote.us, and you can do it right online. You have to hurry. The deadline to register is this Monday, October 5th. If you're registered, you need to make a voting plan. How are you planning on voting? If it's by mail, you need to get your ballot request in by October 31st. But don't wait. Don't wait till the last minute. Do it now. Then, as soon as you get your ballot, you need to fill it out and send it in immediately. If you mail your ballot promptly, it'll be counted. If your plan is to go down to the Board of Elections to vote in person and early, you can start doing that on October 6th, Tuesday. And that works too. And of course, you can still go to your local polling location on election day. Just make sure that you have a plan in place and that you follow it. For those of you who want to know how else you can support and help, the Board of Elections still needs poll workers. They especially need people who are willing to travel from their residence area to another location in the county. And they need Republicans so that poll workers are balanced between parties. And they need people who speak speak Spanish. So especially if you fit into any of those categories, go ahead and apply to be a poll worker by going to 443vote.us. That's 443vote.us. And if you know people who might need a ride, either downtown or to vote early or on election day, please reach out to them and volunteer to drive them. Remember, of course, that if you do, you have to wear your mask. These are difficult times. They're like no other we've lived through. It's up to each and every one of us to participate in this great democracy. It's our personal responsibility to uphold what others have lived and died for. Finally, I want to address the news today that the President and the First Lady have both tested positive for COVID-19. No matter what your political beliefs are, I hope we can all agree that we do not wish anyone harm or ill health. My prayers are with the President and the First Lady. I wish them both a speedy recovery. Thank you.
Thank you, Executive Budish. As always, we appreciate your partnership and continued support and collaboration across all of your county departments that have been working very closely with us throughout this pandemic. Certainly, we share the concerns for the President and his family and wish a speedy recovery as well. Today, as you've mentioned, I'm joined by our Director of Epidemiology, Surveillance, and Informatics, Jana Rush, who will walk through a portion of our data brief that is now posted on the web, followed by Dr. Gullett, who will also cover a number of clinical components, testing related issues, and similar updates. So yesterday, Governor DeWine announced that we're happy to report that we're still orange, risk level 2, public health emergency level in the public health advisory system for the state. And I believe this is the seventh week in a row that we've remained in the orange rating category. Counties in risk level 2 or orange are advised by the Ohio Department of Health to exercise a high degree of caution. It's quite an achievement to be at orange for 7 weeks in a row, and the credit goes to you. It goes to everyone out there in our community who has embraced the power of public health prevention during this pandemic. So this continues to be very good news, and our indications, again, that we continue to move in the right direction. And you'll hear some other data that validates that as well from both Jana and Dr. Gullett. It's now clear, very clear, that our high degree of local mask use, following a physical distancing guidance, implementing remote work options, promoting hand hygiene, and staying home when you're sick all work. I think that the debate is over there. We need to continue to follow the playbook and do our part to keep our community safe. Our continued vigilance is our way out of this pandemic. We know that we're not out of the woods yet. As Executive Budish mentioned, the flu season is upon us, and we still have the release of the COVID vaccine into next year that lie ahead and are part of our continued response and our way through this pandemic. As of yesterday, there were 17,704 cases of COVID-19 that have been reported in all of the county, including the city of Cleveland, with about 15% of these cases, or 2,600 people, requiring hospitalization. And this has been the highest number of hospitalizations in the state since the beginning of the pandemic. Of the total cases, 3.7%, or 658 people, have died since March. Friends, family members, neighbors, senior citizens, people that matter to all of us have died. And it's important that we take a moment to recognize the losses and the pain that this pandemic has inflicted on families throughout our community. We know this coronavirus spreads easily, and people without symptoms can unknowingly transmit the virus to others. And infectious diseases do not recognize borders on a map. Governor DeWine announced that Ohio will begin indoor visitation, switching gears, indoor visitation at nursing homes, long-term care centers, and intermediate care facilities after closing their doors due to COVID-19. Intermediate care facilities, which is where people are supported that live with developmental disabilities, resumed visits on September 28th, and nursing homes and long-term care facilities can follow on October 12th. Ohio has permitted outdoor visits at assisted living facilities since June and at nursing homes since July. With the cold weather, certainly guidance now needs to be put in place about how you can transition to indoor visits and do that safely. The state plans to limit visitors to 2 at a time for a maximum of 30 minutes per visit. All visitors will be required to wear a face mask and must maintain social distance with family members. And all visitors must schedule their visits in advance, and both visitors and staff will undergo a health screening before entering the building. It's important to know that each facility will make decisions on allowances relative to visitation based on the risk that they see presented in those facilities at any given time. Since the switching gears now into flu, since the onset of the flu season, we've been encouraging everyone to roll up their sleeves and get their annual vaccination. I got mine last week at one of our drive-through clinics. The Cuyahoga County Board of Health has been holding their drive-through flu clinics open to the public at our office every Wednesday from 9 to 11:30 in the morning. You can also get a flu shot at our Warrensville Heights clinic by appointment in order to maintain social distancing. As we said on many occasions, if there ever was a year to get your flu shot, this is the one. Pharmacies, hospitals, community clinics all have flu vaccine available, and you can go to fluvaccinefinder.org to find options in your area. The Ohio Department of Health is also developing a media campaign for flu with more information forthcoming. As we look ahead to the flu season and more school reopenings in our community, we need to remember what has worked and stick with it. We've had a high masking rate in our community, sound planning and implementation of school reopenings, and prevention vigilance. It's working. As we've seen in the past, things can change quickly if social contact and interaction without prevention increases in the community. Everyone's tired as we continue to live through this pandemic. Everyone's tired. But we know that ensuring that sound prevention practices that got us here need to remain front and center in our response. This is how we protect our families, our neighbors, our senior citizens, our classmates, our co-workers, and how they protect us. So right now, those are our main messages that we want to share. And it's now time for me to turn things over to our Director of Epidemiology, Surveillance, and Informatics, Jan Rush. Okay.
Good afternoon. Thank you for having me. Today I'll be covering our data brief today and the impact of COVID-19 that's currently impacting the community. So as you can see, we've had over 12,000 cases reported to date. We've had approximately 50 new case reports per day for the month of September, and that has decreased over time. We had about 80 new case reports in August and about 115 in July. So those new case reports are decreasing overall that we're receiving each week, but our new cases continue to increase week over week. We've had 561 deaths reported in our community. That represents approximately 4.5% of our cases. That has remained stable over the past month, but we did have fewer deaths reported this week than we did from the previous week. Our hospitalizations represent approximately 10% of our cases. This has also remained stable over the past month. Over 90% of our cases are presumed to have recovered from their illness, which is encouraging. There has been a slight increase over the past month in the number of cases that we have presumed to be recovered. Okay, so now moving into some of our demographics. So females represent the largest proportion of our cases at nearly 60%. Also for our age group, the majority of our cases are among young adults from 20 to 39 years old, and they represent approximately 35% of our cases. Children represent about 10% of our cases, and that has also remained stable over the past month. So for race indicator, our white race is represented by 49% of our cases, and Blacks represent 37% of our cases. This has also remained stable over the past month. The number of healthcare workers that are represented by our cases is at 16%, and those with pre-existing conditions is at 37%. This number has also remained stable over the past month among cases in our community. So next, we have our epi curve. So our epi curve represents the number of new cases that we have seen in the community by illness onset date as of October 1st. So as you can see with this graph, our highest peak of cases did occur in July to date. And at the end of that graph, some cases may have occurred this past week or so, but we may not have received the reports for those cases to date. So we are moving in a good trend as far as the number of cases that are being reported to us weekly. And next we have our zip code map. So our zip code map also has remained stable over the past month. So as you can see, the southeastern suburbs as well as the northwest suburbs represent the highest frequency of cases here in the county. And this also includes the city of Cleveland as well. So overall, what does this tell us about COVID-19 spread in our community? In conclusion, this is letting us know that there is still increased spread and impact of COVID-19 in our community, but the daily prevention methods that our community members are taking through hand washing, social distancing, and as well as wearing masks is helping to slow the spread of this virus and illness within our community. So we should continue to stay vigilant about staying with those prevention practices as we head into the fall, with more people being indoors over the fall and winter. And that concludes this section of our EPI brief. And so now I will turn this over to Dr. Gullett to discuss our clinical and testing information and data.
Thank you so much, Jana. So I'm going to just finish out the EPI brief that we customarily review each week. And you can see the hospital utilization data in front of you. These are the same 4 metrics that we have been following since March. If you look at the adult medical surgical bed utilization, it's pretty stable in the mid-80s this week at 86%. Our adult ICU utilization dropped just a few percentage points from last Friday at 83%. You can see for the pediatric